Before watching this video, I recommend you subscribe to this channel and activate the notification bell to find out when I upload a new video. Thank you. Common causes of bloody stools. There are several potential causes of blood in the stool, ranging from benign conditions to more serious health issues. Here's a detailed overview of the most common culprits. 1. Hemorrhoids. Hemorrhoids are swollen veins in the lower rectum and anus, often causing bleeding during bowel movements. They can be internal or external and may be accompanied by itching or discomfort. Blood from hemorrhoids typically appears bright red and is usually noticed on toilet paper or in the toilet bowl. 2. Anal fissures. Anal fissures are small, painful cracks in the skin of the anus, often caused by passing hard stools. Like hemorrhoids, anal fissures can lead to bright red blood during bowel movements, accompanied by sharp pain. 3. Inflammatory bowel disease, IBD. Conditions such as ulcerative colitis and Crohn's disease fall under the umbrella of inflammatory bowel disease. These chronic conditions can cause inflammation in the digestive tract, leading to ulcers that may bleed. The blood in IBD can vary in color and is often accompanied by other symptoms like abdominal pain and diarrhea. 4. Colorectal cancer. While less common than other causes, colorectal cancer can cause bleeding in the stool. This blood may appear dark red or even black, depending on the location of the tumor within the colon. Other symptoms can include weight loss, changes in bowel habits, and persistent abdominal discomfort. 5. Constipation. Severe constipation can lead to straining during bowel movements, potentially causing small tears in the anal area or exacerbating existing hemorrhoids. This can result in the presence of blood in your stool. 6. Rectal prolapse. Rectal prolapse occurs when the rectum protrudes from the anus, which can cause bleeding and discomfort. This condition is more common in older adults and can be associated with chronic constipation. 7. Rectal polyps. Rectal polyps are growths on the lining of the rectum that can bleed. While many polyps are benign, some can develop into colorectal cancer over time, making it essential to monitor and potentially remove them. 8. Ulcers in the rectum. Ulcers can form in the rectum due to various causes, including infections, inflammatory conditions, or the use of nonsteroidal anti-inflammatory drugs, NSAIDs. These ulcers can lead to bleeding, often presenting as bright red blood in the stool. 9. Injury to the mucosa. Injury to the mucosa, the lining tissue in the colorectal system, can occur from trauma, vigorous cleaning, or other mechanical causes. This can lead to bleeding and the presence of blood in the stool. 10. Diverticular bleeding. Diverticular disease is characterized by small pouches, diverticula, that form in the walls of the colon. When these pouches become inflamed or infected, they can bleed, leading to noticeable blood in the stool. When to see a doctor. If you notice blood in your stool, it's essential to assess the situation carefully. Here are specific guidelines for when to contact a healthcare provider. Contact a healthcare provider if the bleeding lasts over 3 weeks or is heavy. You experience aggressive bleeding or other severe symptoms. You have a family history of bowel cancer. Seek emergency help if you should seek immediate medical attention if you have significant rectal bleeding and experience any of the following signs of shock. Rapid, shallow breathing, dizziness or lightheadedness after standing up, blurred vision, fainting or confusion, nausea, cold, clammy, pale skin, low urine output. These symptoms can indicate a more severe underlying issue that requires prompt treatment. Diagnostic procedures. When you consult a healthcare provider about bloody stools, they may perform a series of diagnostic tests to determine the underlying cause. Here are some common procedures. 1. Digital rectal exam. A digital rectal exam involves the doctor using a gloved finger to check for abnormalities in the rectum and anus. This can help identify hemorrhoids, fissures, or other issues. 2. Colonoscopy. A colonoscopy is a procedure that allows the doctor to examine the entire colon and rectum using a flexible tube with a camera. This test is crucial for detecting polyps, tumors, and other significant conditions. 3. Endoscopy. An endoscopy may be performed if there's a need to examine the upper digestive tract. This procedure uses a thin tube with a camera to look for bleeding sources in the esophagus or stomach. 4. Imaging studies. In some cases, imaging studies such as CT scans or MRI may be ordered to assess the condition of the intestines and detect any abnormalities. 5. Stool tests. Stool tests can help determine the presence of blood, infection, or other issues within the gastrointestinal tract. These tests can be an essential part of diagnosing the cause of bloody stools. Conclusion: blood in your stool can be a concerning symptom that may indicate various underlying conditions, ranging from benign to serious. Understanding the potential causes, recognizing when to seek medical attention, and knowing the diagnostic procedures involved can empower you to take control of your health. If you notice any signs of blood in your stool or experience other alarming symptoms, don't hesitate to consult a healthcare professional. Early diagnosis and treatment are crucial in managing any underlying issues effectively.